MIT researchers discovered that students who used this 200-year-old learning technique retained 340% more information than traditional methods, yet 99% of people have never heard of it. Wait, that's not what we're here to talk about today, but it illustrates something crucial. Sometimes the most important health information gets overlooked by mainstream medicine. And when it comes to vitamin D after 60, there's a similar pattern happening right now. Most doctors will tell you to take 800 to 1000 IU of vitamin D daily after 60. But what they don't tell you could be the difference between thriving in your golden years and struggling with bone fractures, immune problems, and cognitive decline that could have been prevented. I'm about to share what cutting-edge research reveals about vitamin D dosing for seniors, information that could transform your health, but that most medical professionals either don't know or aren't sharing with their patients. If you're over 60 and taking the standard vitamin D dose your doctor recommended, you need to hear this. Because the truth is, the dosing guidelines most physicians follow were created decades ago based on preventing rickets in children, not optimizing health in aging adults. Today, you're going to discover why the current RDA for vitamin D is dangerously low for seniors, the optimal dosage range that research actually supports how to test properly and avoid the most common dosing mistakes, and the 3 critical factors that determine your personal vitamin D needs. But first, let me ask you something. Have you ever wondered why some people in their 70s and 80s seem to have boundless energy, strong bones, and sharp minds, while others struggle with frequent infections, falls, and fatigue? The answer often lies in something as simple as getting the right amount of this crucial vitamin. Do you find yourself getting sick more often than you used to? Are you experiencing unexplained fatigue, especially during winter months? Have you noticed muscle weakness or bone pain? Maybe you're dealing with mood changes or difficulty concentrating. These aren't just normal aging, they could be your body's way of telling you it's starving for adequate vitamin D. Here's what's really happening in your body after 60, and why the standard dosing fails you. As we age, our skin becomes 75% less efficient at producing vitamin D from sunlight. Our kidneys also become less effective at converting vitamin D into its active form. Meanwhile, many seniors spend more time indoors, live in northern climates, or have darker skin, all factors that further reduce vitamin D production. But here's the kicker. The current RDA of 800 IU was designed to prevent deficiency diseases, not to optimize health. It's like saying you only need enough water to prevent dying of thirst, rather than enough to feel energized and healthy. Recent studies show that blood levels of 30-50 ng/ml are optimal for seniors, but achieving these levels often requires 2000-4000 IU daily, sometimes more. For the next moment, I want you to simply observe your current relationship with vitamin D. When did you last have your levels tested? Do you know your actual blood level? Or are you just taking what your doctor suggested years ago? Most people are flying blind when it comes to this crucial nutrient. Don't judge yourself for this. The medical system hasn't made it easy to get proper guidance. What if I told you that vitamin D isn't actually a vitamin at all? It's a hormone that affects virtually every cell in your body. This changes everything. When you understand that vitamin D acts more like a master regulator of your immune system, bone health, brain function, and even mood, you realize why getting the dose right is so critical. Think of it this way. You wouldn't guess at your blood pressure medication dose, would you? Yet that's exactly what most people do with vitamin D. Here's the evidence-based approach that's helping seniors optimize their vitamin D levels. Step 1. Test first. Get a 25-hydroxy vitamin D blood test. Don't guess, measure. Optimal levels for seniors are 40-60 ng/ml, not the 20-30 ng/ml that labs often call normal. Don't guess, measure. Step 2. Calculate your needs. Research suggests most adults over 60 need 2000-4000 IU daily to maintain optimal levels. Some may need more, especially if you weigh more than 150 pounds, have darker skin, live north of Atlanta, spend most time indoors, take medications that interfere with vitamin D. Step 3. Choose the right form. Vitamin D3, cholecalciferol, is more effective than D2. Take it with a meal containing healthy fats for better absorption. Imagine how it will feel 6 months from now when your energy levels are stable throughout the day. Picture yourself with stronger bones, fewer colds, and a sharper mind. Think about the confidence that comes from knowing you're giving your body what it truly needs to thrive. This isn't a take it and forget it approach. Plan to retest your levels every 3 to 6 months initially, then annually once you've found your optimal dose. Remember, it takes 2 to 3 months for vitamin D levels to stabilize after changing your dose, so be patient with the process. Be patient. You have everything you need to take control of your vitamin D status. The research is clear, the testing is available, and the supplements are affordable. You don't need to accept fatigue, frequent illness, or bone problems as inevitable parts of aging. This isn't just about preventing deficiency, it's about optimizing your health span. Every day you maintain adequate vitamin D levels is a day you're investing in your future mobility, cognitive function, and overall vitality. If this information is opening your eyes to something you hadn't considered before, I'd love to hear from you in the comments. Share your current vitamin D dose and whether you've had your levels tested recently. Before I continue, I want to be clear. This information is for educational purposes and shouldn't replace professional medical advice. Always work with your healthcare provider when making changes to your supplement routine, especially if you have kidney problems, take certain medications, or have other health conditions. I'm really proud of you for taking the time to learn about optimizing your health after 60. It takes courage to question conventional wisdom and seek better answers for your well-being. If you want to dive deeper into evidence-based health strategies for seniors, I've created a playlist with more videos covering the nutrients, lifestyle factors, and health practices that can make the biggest difference in your golden years. I'm committed to bringing you the latest research and practical strategies that can help you not just live longer, but live better. Every video in this playlist is designed to give you actionable information you can use right away. Click on the playlist link in the description below and let's continue this journey toward optimal health together. Your future self will thank you for the knowledge you gain today. Remember, aging doesn't have to mean declining. With the right information and consistent action, your 60s, 70s and beyond can be your most vibrant years yet. I'm really proud of you for taking the time to learn about optimizing your health after 60. It takes courage to question conventional wisdom and seek better answers for your well-being. If you want more, click the playlist and subscribe. Let's keep learning together. Test first, calculate your needs, retest regularly. Your future self will thank you. See you in the next video.